Welcome everyone. Today we will explore neurodevelopmental disorders, their characteristics, and their impact on individuals throughout their lives. Today we will focus on two major disorders. One, intellectual disability, and second, autism spectrum disorder. First, we will discuss about the definition of neurodevelopmental disorders. Neurodevelopmental disorders are characterized by impairments in brain function that can significantly affect various aspects of an individual. While some children may outgrow certain symptoms, many individuals face challenges throughout their lives. Coming toward the characteristics of neurodevelopmental disorders, these disorders typically manifest before a child enters school, leading to various developmental deficits. The severity and the type of impairment can vary widely among individuals, affecting their ability to function in daily life. Intellectual disability. Intellectual disability, previously referred to as mental retardation. This is defined significant limitations in both intellectual functioning and adaptive behavior. Intellectual functioning can affect a person's ability to communicate, socialize, and live independently. When we talk about the diagnostic criteria for intellectual ability, to diagnose intellectual disability, clinicians must confirm deficits in intellectual functioning through standardized testing and assess adaptive functioning. These criteria ensure that individuals receive appropriate support based on their needs. Coming toward the severity specifiers for intellectual disability, the severity of intellectual disability is characterized based on adaptive functioning rather than IQ scores, as adaptive functioning better reflects the level of support an individual may require in daily life. Global development delay. Global development delay is used for every young children who show delays in multiple areas of development. It is crucial to understand that these children periodically to determine if they continue to meet the criteria for this diagnosis. This was about intellectual disability. Now, coming towards the second disorder, autism spectrum disorder. Autism spectrum disorder encompasses a range of symptoms that can vary significantly in severity. Individuals with ASD may struggle with social interactions and exhibit repetitive behaviors or intense interest. This is the diagnostic criteria for autism spectrum disorders. When you diagnose that someone has the autism spectrum disorder, his or her social communication effect, abnormal social interactions, and non-behavioral communication, restricted behavior, stereotyped movements, insistence on sameness and fixed interests. Third, severity specifications based on social communication, impairments, and behavioral patterns. Explanation of diagnostic criteria for autism spectrum disorder. Such people have poor social communication, they have poor social interactions. Obviously, as I told you earlier, that they have restricted and repetitive interests or activities. They have also restricted patterns of behavior. Their social imagination and flexibility of thoughts also impact as compared to normal people. Unusual response they give. Here are some important additional considerations for ASD. Its symptoms present in early childhood but significantly impact on social, occupational, or other important areas in person's life. It is also important to understand the comorbidity. Disturbance is not better explained by intellectual disability or global developmental delay. After considering the diagnostic criteria of autism, it is important to understand the treatment of this disorder. For the treatment, it is important that should give the sustained attention and concentration to such people. To solve the learning problems of such people, activities of daily life should be managed. Motor coordination is very important. Communication skills training, very important. And there are also some type of psychological therapies that are recommended for this autism spectrum disorder. For example, the cognitive therapy and the techniques of behavioral therapy. We will conclude today's session. Early diagnosis and interventions are critical for individuals with neurodevelopmental disorders. Ongoing research is vital to enhance our understanding and improve support system for affected individuals and their families. Thank you.